one is the hand-sewn, the old-fashioned operation. This is a stent graft deployed inside. The aneurysm's here, actually inside the aneurysm. This is just kind of gives you an idea about the exposure as opposed to a major abdominal incision. You're looking at an incision in each groin. This is a before and after picture, and basically this is the aortogram. The aneurysm here, the device in place now. You do not see the aneurysm because the dye we use for the arteriogram, and this is an intraoperative picture. Basically, when we do these, we're doing them through groin approaches, but we are patients laid out on a fluoroscopy table, which is a special x-ray table, and we have special x-ray equipment that allows us to take images like this in the operating room. Again, the anatomical issues have to be extremely precise, and basically once we get the device in place, we do some confirmatory x-rays to make sure we accomplish what we wanted to accomplish. And in this case, we've got a seal, right, these are the kidney arteries right here. We've got a seal right below the kidney arteries with the top part of the stent graft, and the stent grafts all come down into the iliac arteries down here. The area where the aneurysm is, you don't see here because the black, which is the dye we've injected, is now running from the aorta. We want to preserve our kidney arteries, of course, and it's now going down the device into the iliacs. So we basically diverted the flow of blood away from the aneurysm. This is simply a slide, I guess, to remind myself to tell you that it is important, and in fact every person we deploy a stent graft in, and this is true of surgeons all over this country, we are obligated to make sure that we've explained to our patients they do need to follow up. And typically we do CAT scans. There are some comments here about ultrasound and x-rays. Most surgeons nowadays feel the CAT scan is the single most important test, and typically after a patient has the repair, in the first 6 weeks or so we'll do a baseline CAT scan, and then typically we'll check one at about 6 months, and then typically yearly thereafter if there are no problems. The repair of this is a little bit different than traditional surgery, where basically we have nurses, Dr. Wolken and myself, anesthesia. In this repair, we actually have, of course, us, the vascular surgeons, the anesthesiologist, the nurses, and the radiographic folks, and you can see this is our setup in our room here, and basically we have down here a power injector, which is the device that allows us to take the pretty pictures that we need for decision making in the operating room. That injects the dye directly in the vessels.